Most everyone will agree that children are our most important asset. Yet funding for children in Florida, especially for programs that benefit those in the first 5 years of life, are at the bottom of our state budget priorities. We have known for years that 90% of the human brain develops during the first 5 years of life. Yet our state spends only 3% of its revenues on early childhood health and education programs. The Children's Movement of Florida, after extensive consultation with advocates and experts and statewide polling, has identified 5 areas to address that would substantially improve the future for Florida's children. Number 1. More than 500,000 children lack access to quality health care. Florida ranks next to last among the 50 states in the percentage of children without health insurance. These children lack preventive care, do not receive treatments they need when they're sick, and when they finally enter a hospital, may be twice as likely to die as children with health insurance. Number 2. Florida does not have a comprehensive screening and treatment program for children with special needs, such as autism, dyslexia, cerebral palsy, learning disabilities, and other challenges. Concerned parents frequently don't know where to turn for advice. Children with problems that might be temporary or reversible if detected early, if not identified, grow up with disabilities that can become more severe and permanent. Number 3. Florida's pre-kindergarten program is way underfunded and fails most national high-quality standards. Even though voters approved in 2002 what they were told would be a high-quality voluntary pre-K program to be made available at no cost to all Florida 4-year-olds, the legislature has never provided the proper level of funding for this program. Children who receive quality care and educational experiences in the early childhood years have better school achievement, lower dropout rates, better employment opportunities, and a much lower chance of being incarcerated than children who do not benefit from this program. Number 4. Many parents in Florida simply do not have access to responsible information, to the latest research, and to professional advice and guidance when it comes to their children. Number 5. Florida is no longer the national leader in mentoring, connecting tens of thousands of children with dedicated adults that can help guide and counsel them. The Children's Movement of Florida envisions specific, realistic, achievable, and affordable legislative action during the 2011 session. Number 1. Florida should provide health insurance for 300,000 additional children. Most children in Florida without health insurance are eligible for the KidCare program that would pay for their health care costs with mostly federal funds. But parents are frequently unaware of KidCare or have not been able to complete the registration process. Florida should fund an outreach program that connects with eligible families and pay for the state's portion of coverage. Number 2. Florida should create a universal screening program that would help parents figure out whether their child might have a special health, developmental, or behavioral need. Information would be available through the internet, a toll-free line, and through community groups. Number 3. Florida should increase the quality of its pre-kindergarten program by providing more funding to hire and retain better qualified teachers. The extra money would also ensure that all caregivers receive more professional training, implement a research-based curriculum in all pre-K classrooms, and that the accountability system is improved. This will help children receive the highest benefit from their pre-K educational experience. Number 4. Florida should fund a statewide phone line, website, and awareness campaign that provide information to families on issues related to development and effective parenting, and give families real wisdom on their concerns about their children. Number 5. Florida should reactivate the strategies that made Florida a national leader on mentoring. It would require leadership, planning, and a small amount of funding to coordinate research-based mentoring initiatives and assess mentoring programs. These 5 proposals all cost money, about $300 million in total, or less than 1% of the approximately $40 billion the Florida legislature will collect this year. Can we afford this in a year in which Florida faces a significant budget deficit? Yes, indeed, we must afford it. The very future of Florida's children, of Florida itself, depends on such investment. It's time to make our children a much higher priority. The truth of the matter is, the state of Florida has never had a problem figuring out how to find money for projects and programs like prisons, roads, high-speed trains, sports stadiums, and much more. Which brings us to this question. If children are our future, shouldn't we invest more in them now?